Go.
Hi, how you doing? My name is Alfredo Gutierrez, level 2 nursing student with SPC. And you are?
Jennifer Moya,
Let me verify this and your date of birth.
7/11/2000.
Beautiful. And do I have your permission to record this session?
Yes.
All right, let me wash my hands and ask you a few silly questions. Why are you here today?
Just a checkup.
Okay, and do you know where you are?
Yep, at a clinic.
Okay, great. Do you know what year it is?
2020.
And how'd you get here?
I drove.
Okay, so our patient is alert oriented to person, place, time, and event. Now, part of this assessment, we're going to take a look at all your system here. And we'll look at the head, make sure it's normal cephalic, and make sure it's symmetrical, make sure there's no skin breakdowns, make sure that the scalp is intact and no areas of dryness, and that the hair is evenly distributed. The hair appears to be strong in texture as well. And we're going to take an opportunity and look at the ears, make sure that there's no drainage, and the skin behind the ears is intact. We're going to do the same thing on this side here. Ears, no drainage, and the skin is intact. We're going to look at her facial features. As we look at the facial features, we're looking for symmetry. Go ahead and smile for me, nice and big, beautiful. Raise your eyebrows up, squint your face. All right, stick out your tongue midline. Beautiful, open your mouth. The tongue is pink and moist. The gums are intact. There's no lesions. Any soreness or any pain in your mouth?
No.
Okay. Any difficulty swallowing?
No.
Okay. We're going to take a look at your pupils. As we look at your pupils here, we're going to check to see their reactiveness, okay? So just go ahead and look straight ahead. We're going to look at the right pupil first, it reacts there. The left pupil, it reacts there. Now, while we shine the light in the left eye, we're going to look at the right eye, and that reacts as well. Same thing with the left eye, and it's perfect. All right, now accommodation. I want you to focus on the pen, and when I tell you to, you're going to change your vision and look at the wall, okay? And you focused, now look at the wall. All right, the pupils are reactive. So we're going to check the movement of your eye and check the cranial nerve. So I want you to look at my pen and only move your eyes. Ready? We'll go that way and down. I'm going to go this way and down. And now we go up, down, left, and right. Okay, perfect. Cranial nerves are intact. Now we're going to do a quick whisper test. The whisper test requires me to tell you something in your ear. You're going to just repeat what I tell you, okay?
1, 2, 3.
And we'll do the same thing on this ear over here.
1, 2, 3.
All right, perfect. While we're here, we're going to look at her neck, and we're going to check for the jugular veins, make sure that there's no distension. And the jugular veins appear to be normal. Trachea appears to be midline. We're going to palpate the lymph nodes here and make sure that there's no swelling in the area. Go ahead and swallow. Any difficulty swallowing?
No.
All right. The trachea seems to be midline. There's no deformity to the trachea, and there's no swelling. All right. We're going to check the carotid pulse. We're going to do the left first. No longer than 10 seconds. We'll do the right. And it's good. And she's got +4 carotid pulses bilateral, and they're equal in strength. Go ahead and turn your legs this way while I take a listen to your lung sounds. We're going to listen to the lung sounds on the posterior region. We'll do the left lung first. What I'd like you to do is breathe in through your mouth and out through your mouth. Okay? Go ahead, breathe. All right, mid-clavicular, inside the scapula. All right, the right side, listening to the apex of the lungs. Now the base on the right. All right, blow it out. The left and the base, up. There you go. Okay, you can go ahead and sit back normal. What I want you to do is shrug your shoulders up to your ears. Okay, good. We're going to take a listen to her heart sounds. The heart sounds, we're going to listen to the aortic valve, the pulmonic valve, the tricuspid, and the mitral valve. The aortic and pulmonic are in the second intercostal space. We'll listen, you use the bell. Just lateral of the sternum. All right. Pulmonic valve. All right, the tympanic valve. The tricuspid valve. Okay, go ahead and lift your breast. And we'll do the mitral valve. Okay, perfect. Now, when we're assessing the patient's apical pulse, it's for 60 seconds. And while we're doing that, we're also going to check her radial pulse to make sure that there's pulse deficits not present and make sure that it's equal. And while we're here, we're also going to assess our patient's radial pulses. She's got +4 radial pulses. Go ahead and grip strength. All right, good. Now push. Now pull. Great. While we're here, we're going to look at her hands. Make sure there's no skin breakdown. There's no swelling in the knuckles. Her wrists look good and intact. Her elbows look fine. We're gonna look at the nails and the nail bed, make sure that there's no dryness and there's no signs of dermatological issues. We're gonna check her hands and we're gonna check the cap refill as well. Cap refill, all right, it's less than 3 seconds, okay? So let's go ahead and have you lay down. I'm gonna ask you a few questions. Any nausea, vomiting, or diarrhea?
Nope.
No vomiting, no nausea, no diarrhea, okay? When was your last bowel movement?
This morning.
All right, normal?
Yes.
Is it normal? What's the consistency? Was it a hard
Solid.
stool, solid, hard, or soft?
Hard.
Is it normal for you to have hard stools, or do you? Okay, no history of constipation or anything like that. All right. Go ahead and lift your shirt up, and we're gonna go ahead and listen. We're gonna look first, and we're gonna inspect for any signs of distension, any signs of issues with the skin. No scarring, no modeling. There's no signs that the skin is impaired in any way. We're gonna listen to the right upper quadrant. Bowel sounds are present. The left upper quadrant. Bowel sounds present. Left lower quadrant. Bowel sound present. Right lower. Bowel sound is present. Now we're gonna palpate her abdomen. As we palpate, we're gonna ask our patient, do we feel any pain? No pain? Any discomfort?
No.
Nothing? How about here? Nothing? How about here? Nothing? Okay, great. All right, when was your last menstrual cycle?
A week ago.
A week ago. Are you on birth control?
Yes.
Okay. What kind of birth control do you use?
Sprintec.
Okay. And what about sexual activity? Are you sexually active at the moment?
Yes.
And are you making sure that you use protection when you are sexually active, and you know what to look for when it comes to sexually transmitted diseases, any kind of infections, itchiness, burning, anything like that? Do you have any discomfort when you urinate? All right. No foul odor, no discolor, no cloudy urine, nothing like that, right? Okay. No discharge or nothing, right? Okay, perfect. So while we're here, we're going to take a look at her abdomen, at her legs. And as we look at the legs, we're going to assess the skin, specifically around the region of the knees, the ankle, and also the back of the heels, and looking for any ulcerations or any skin tears or breakdown. We're going to do the same thing on the other leg. We're going to look for the edema, any edema noted, and basically to assess the edema, we'll press on the tibial region, and we release and find out if there's any pitting. There's no pitting edema anywhere. We're gonna look at her feet. Her feet are basically intact. They have cap refill is less than 3 seconds. We're gonna look in between the toes and the skin to make sure that there's no signs of dry areas. All right, go ahead and have a seat. And go ahead and stand up for me. We're gonna take a moment and look at her back, and we're gonna inspect the sacral area, and we're gonna inspect the back of the legs to make sure that there's any no skin breakdown or no areas of the skin that are compromised at this time. All right, you can have a seat. And this concludes our physical assessment at this time. Thank you very much.